Well, hello, it's Bruce Williams again, and I think it's time for another Growth Path Challenge. This one is going to be Growth Path Challenge number 79. Are you ready? I sure am. Slide number 1 is tissue from an adult rat. Can you give me a morphologic diagnosis? Okay, time's up on this one. This one should be pretty straightforward. We have two very large kidneys. It's an adult rat, and the most likely possibility here is bilateral hydronephrosis. You can see these huge kidneys in a very young rat or a newborn rat pup, and you may want to think about adult recessive polycystic kidney disease, where the animals are born with huge kidneys. That really hasn't been documented in the rat that I know of. Now, hydronephrosis has been documented pretty well in certain strains of albino rats. It's usually unilateral, and for some reason it often appears on the right, but you can get bilateral cases. This is most likely acquired, and in this particular animal, since both kidneys are affected, it's probably a problem that's arising in the bladder or the urethra. Remember, both ureters dump into the trigone. And then if you have severe inflammation, which may be accompanied by stones in rodents, then you can have blockage of that vesicoureteral valve and end up with hydronephrosis. The kidneys don't know that the urine's not going out. The glomeruli, the tubules will keep filtering urine, and then the kidney will swell. So bilateral hydronephrosis in a rat. Slide number 2 is a wonderful picture. It's from an ox. It's from Dr. Stephen Cahalan. And I need a morphologic diagnosis and a cause. Okay, time's up. Boy, if you were in the room with this animal, you would certainly smell it because it would stink to high heaven. And what we're looking at here, if you had trouble getting started on this slide, is we're looking at a cross-section of the heart. Here's the lung here. Here's a very thickened pericardial sac, and on top of the sac and inside the sac is a tremendous amount of fibrin and pus, and you can see the epicardium is pretty thickened here. It's collagenous. And this is a classic case of traumatic reticuloperitonitis or hardware disease. The morphologic diagnosis would be a diffuse fibrinosuppurative pericarditis and epicarditis. And the cause is a penetrating wound, generally from the reticulum, because cattle are somewhat indiscriminate when they eat. They will often ingest some foreign material, could be magnets, could be sometimes small bits of wire. And if the wire is bent, it can penetrate the reticulum. All this stuff ends up in the reticulum. And upon muscular contraction of reticulum, it can actually penetrate the wall of that reticulum and into the pericardial sac. And because that wire is usually bent at the end, it doesn't go all the way through. If it went all the way through into the pericardial sac, it wouldn't cause that much of a problem. But because it gets stuck there with one end in the pericardial sac, one end of the reticulum, it continually wicks bacteria and protozoa into the pericardium, which becomes a mess. There's two major ways that you get fibrin in the pericardium. Sometimes with systemic illness or systemic sepsis, you will get fibrin that will deposit into potential spaces, like the joints, the meninges, and the pericardium. It's usually not a whole lot, and it doesn't smell bad. The other way is a penetrating injury, usually from the forestomachs of ruminants, but occasionally you can see it in a horse as well. That's pretty uncommon. But the stuff that comes out of the rumen is all sorts of crazy bacteria, and usually you smell the pus as well. It's much more pus and fibrin than just fibrin. So those are two ways: systemic sepsis, fibrin only, and a penetrating wound, usually pus and fibrin. Slide number 3 is tissue from a sheep. Can you give me a morphologic diagnosis? Okay, we are looking at the point of the mandible of this sheep. Most likely morphologic diagnosis for this tumor. It's smooth, it's at the point of the mandible. There doesn't seem to be any teeth in it or tooth fragments. So the most likely diagnosis is an ossifying fibroma. You can look this one up in Gemma Kennedy. There's a great picture um, of one in a sheep there, and it's sort of cut cross section. Is a much easier gross diagnosis. It is a histologic diagnosis. These tumors of the jaws, they've been classified and reclassified, subclassified. But generally, when I see it at the point of the mandible in a ruminant or a horse, my first choice is going to be ossifying fibroma. Histologically, they are anastomosing fine spicules of bone surrounded by a lot of fibroblasts, and there's not a lot of osteoblasts or osteoclasts. It's not that kind of bone lesion. A similar lesion, fibrous dysplasia, tends not to be so much a proliferative growth, but tends to be an area of lucency in the bone. And when you curette it out, you get a somewhat similar histologic appearance. But when I see something at the point of the mandible in a young horse or a young ruminant, ossifying fibroma, it's primarily a disease of younger animals as well. Oh, slide 4 is poor old Tom Turkey, and Tom Turkey's seen better days. Can you give me a morphologic diagnosis and a cause for Tom Turkey's problems? Okay, time's up. This is a classic lesion that you can see in wild turkeys. A lot of birds. Everybody's got a bunch of copies of pictures like this in their collection, so it turns up a lot. And we talked about this lesion a lot of times before in different species. Birds certainly are overrepresented, and the lesion is, or the causative agent is avian pox virus. The morphologic diagnosis, as we said before, is not something that you should have to think about, because the lesion on the skin of these animals, and even in the viscera, in the epithelial cells of the viscera in certain affected species, is always the same. It is proliferative and necrotizing. In order to get more cells to infect, the virus causes a proliferation, in this case mostly in the stratum spongiosum, and then the older parts of this growing swollen skin lesion are the necrotic parts, because they eventually over time are susceptible to cytopathic effects of the virus. And so the center is always necrotic. And so it's a classic pock lesion, swelling with a central area of necrosis. They're all proliferative and necrotizing dermatitis. So you shouldn't have to think about that. Boom, you know exactly what it is. This is a disease that's spread primarily by biting insects. So you're going to see it on the non-feathered parts of the bird. So the face is by far the most common. You could see it in the feet, I suppose, but it's not the feathered areas of the bird. Okay, this is tissue from a lamb. And can you give me a morphologic diagnosis, a cause, and list another likely location for a lesion like this in that animal? Okay, time's up. We're looking at the heart. It's been opened, and you can see that there are tremendous areas of white streaking, almost replacing most of the normal muscle here. And what we're looking at is a combination. This white is a combination of necrosis, fibrosis, and mineralization. It's sort of hard to tell them apart. This is a polyphasic lesion of the muscle. So you're going to see some muscles in active degeneration. You're going to see some that are necrotic, maybe getting cleaned up by macrophages. You're going to see some that are gone and it's been replaced by fibrous connective tissue, because remember, heart muscle does not regenerate well. And then you're going to have minerals sprinkled through it. So that's the definition of a polyphasic disease. This animal probably took a little while before it ended up on the necropsy floor, just was a poor doer. The cause of this condition, which is known as white muscle disease, it's a classic color-based name, is vitamin E and selenium imbalance. I don't use the term vitamin E or selenium deficiency because if you look at the literature on this, some places say, hey, we got great levels of selenium in our soil, our vitamin E is deficient. It could be that the vitamin E is great and the animals may supplement it, but they got poor selenium. There's all sorts of things going on. But remember that vitamin E and selenium are both potent, have potent activity against oxidation of various components of the cell membrane. And so you need vitamin E, you need the selenium as part of glutathione peroxidase to keep your cell membranes in good shape. And with a deficiency of that, we tend to see changes depending on the species. But in ruminants, you will see it certainly in the muscles. You can see it in skeletal muscle. A great spot when you are thinking about this lesion in a lamb. You know, you see it in young animals in the muscles that they use the most. The heart's beating all the time, boom, 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 so it's going to be affected. They don't get up and run around too much, except for baby goats. They get up and jump around. It's really cute. But one of the things that they do use early on in life are the muscles of swallowing and deglutition, the muscles of the tongue and the muscles around the throat. So it's a great place to check for other lesions of white muscle disease. Okay, slide number 6 is tissue from a guinea fowl. I like this one. It's a good Photoshop. Looks like maybe it's the same animal. And we have this here, and now it's gone. But can you give me a morphologic diagnosis and a cause? Sure, guinea fowl are a lot like chickens, so get a lot of same diseases. And if this wouldn't surprise me, this one was from this area in Maryland because a lot of people keep guinea fowl. Don't know what they do with them though. Okay, time's up. So the morphologic diagnosis is a focally extensive granulomatous infraorbital sinusitis. That's where we are right here. We have the infraorbital sinus. You could see this animal probably if before it was incised, there was a big swelling over this. So, and so what's happened is you have a large area of heterophilic debris and macrophages and all that. Remember that birds don't develop pus very well because their heterophils don't have myeloperoxidase, which is required to liquefy pus. So what you get with birds and with reptiles is you get this caseous plug. And so there's probably just not straight granulomatous inflammation, probably a lot of heterophils in there too. So if you call the focally extensive heterophilic and granulomatous infraorbital sinusitis, good on you. The cause, at least in this area, are going to be Mycoplasma gallisepticum. And in this area, interestingly, we have a lot of Mycoplasma synovii that masquerades as gallisepticum. So when you culture these, it's about 50-50 chance which one you're going to get. You're probably going to get a Mycoplasma, but it could just as easily be synovii in this area. Okay, slide number 7 is a great picture from Dr. Oscar Caseta at the University in Canary Islands, and this is tissue from a pig. Can you give me a morphologic diagnosis? Okay, time's up. This is diffuse mesenteric and intestinal serosal emphysema. Okay, so we have all these little bubbles covering the serosa, extending up into the mesentery of the intestine in this pig. And this really is not much of a lesion. It's more of an incidental finding. And so you got all these bubbles, and it's a great lesion. See it a lot in the slaughterhouses. And nobody really knows what causes this. It's been thought that maybe clostridial agents produce gas and they get into lymphatics, because if you take a section of these, some of the lymphatics could be surrounded by some granulomatous inflammation. Nobody really knows. I don't know how many people care about it, but it's mesenteric and intestinal serosa emphysema. Usually goes by mesenteric emphysema. Okay, I had to stop the recording because my neighbors were sort of yelling up and down the hall. Okay, slide number 8 is a great slide, and this is tissue from a raccoon, Procyon lotor. I think everybody knows what a raccoon is. Oh, what do I want? I think I'm going to ask for a morphologic diagnosis and a cause. Okay, time's up. Well, Williams has some rules, and one of Williams' rules is Williams' rule of red guts, number 1. And that is if it's a dog or a cat, you see a red gut's probably going to be parvovirus. Well, uh, there is a slight corollary to Williams' rule of red guts, number 1. If it's a raccoon, it's probably parvovirus too. We see a red gut, it's very dilated here. And when you see red, it's probably hemorrhage, but if you said that this was segmental hemorrhagic enteritis, I'm not giving you full credit. I may give you no credit at all because I might just feel angry because I've been stuck in this apartment for a couple months, but I probably would. But remember, when we see hemorrhage, we're really usually, almost all the time, we're looking at necrosis. So remember, get necrosis in there. So if you said this was a segmental necrohemorrhagic enteritis, full credit. And this is raccoon parvovirus. And raccoon parvovirus is its own entity. They have their own parvovirus, but recently there have been a couple of papers that have identified canine parvovirus type 2 in raccoons, often animals that are turned into rehabilitators. But the raccoon parvovirus is thought to be its own parvovirus. It's not feline parvovirus. It's not canine parvovirus. It's somewhere in the middle. But I think there's an emerging body of evidence that they can pick up canine parvovirus type 2 in certain exigent circumstances. Oh, let's go from Williams red gut number 1 to Williams rule of red gut number 2. We're looking at a piglet. Can you give me a morphologic diagnosis and a likely cause? This is a 5-day-old piglet. Okay, time's up. Remember, when I give you an extra bit of information, if I tell you it's a 5-day-old piglet, there's a reason I'm telling you that. If I say it's a foal or I say it's an adult animal, there's a reason because I want you to think along certain lines. And this is very important in the pathogenesis of this particular disease. So Williams' rule of red gut number 2 is if you see red gut in a production animal, whether it's a pig or a ruminant or even a foal, you are probably looking at Clostridium perfringens. Now, I told you this was a 5-day-old pig. That's very important because that helps you to identify this as possibly the work of Clostridium perfringens type C. And this is a condition that we see only in the very young animals who are not producing trypsin yet because the beta toxin of Clostridium perfringens type C is very trypsin labeled. We don't see this disease in older animals. We see it in young animals within the first week of life because remember, their body's not producing trypsin because they're trying to absorb antibodies, colostral antibodies, through the intestinal wall. And if they were producing trypsin, they would just digest them and they wouldn't get any. So this is a bacteria that takes advantage of that, momentary lapse in making trypsin to cause its great damage with beta toxin. So Clostridium perfringens type C, know that it's the beta toxin, or as my friend Paco Uzal says, beta toxin. I like that. The beta toxin of Clostridium perfringens type C. Okay, and our final slide for today is a great picture by Dr. Pablo Pinero. And this is tissue from an ox. Can you give me a morphologic diagnosis and a cause? Okay, time's up on this one. And this is a once in a lifetime, once in a career event. And Pablo was lucky enough to be there when this animal came through because you almost never, ever see this. If you don't see it, you may see it in South America. You're certainly not going to see it in the US. It just doesn't work like this. We're looking at the lungs. I think everybody probably picked up, and they've been incised. And you can see that throughout the lungs, there are these large caseating granulomas. Some of them even look somewhat pus-like. That's okay with this condition. And, and the exudate is yellow. It's yellow. It's not your typical white pus. It's sort of a yellow pus. Whenever I see that, I want to think, if it's an ox, I want to think of Mycobacterium bovis. Okay, there is something about the exudate that you see has a particular yellow-orange cast to it. Now, this is a very, very atypical presentation of Mycobacterium bovis. When you look at, the large number of reactors that you may see over the course of a year across the country, and then those animals go to slaughter, it's uncommon to find a lesion in them. And if you do, it may be in a lymph node. You're certainly not going to find something like this in the vast majority of cases. Now, how do these lesions occur? Well, sometimes you will have these lymph nodes which get big and they rupture into blood vessels. The bacteria get into the blood vessels, and so they go out wherever they want in their body. So you can see these lesions in the meninges. You can see them anywhere. But it looks very much like experimental cases where you inject Mycobacterium into the blood vessel of a non-human, non-human primate, and they just go everywhere and you get little miliary things. Okay, this animal did not inhale this. This somehow got into the bloodstream, and maybe this might have been the only organ that was obviously affected, but boy, is this a fantastic lesion. I've never been privileged enough to see anything like this in the flesh. So that takes us through Ghost Pat Challenge number 79. I sure hope you enjoyed it. It certainly is a highlight of my day as we combat COVID-19. Looks like we're not going anywhere anytime soon. The cases where I live in Montgomery County in Maryland in the U.S. are still on the rise. We just had our biggest number of cases yesterday. Now, I understand that it's a combination of the testing is getting more widespread, so we're going to pick up more positives, but gosh darn it, I don't think I'm going out anytime soon. So it gives me time to spend with you, and I hope that you find it profitable. With that, I will take a break for a couple of days. My son's having some knee surgery tomorrow from a skiing accident this past winter, and so I got a couple of days where he and I are going to spend some quality time comparing scars. So I hope everybody is staying indoors, is staying safe, and I will see you later on this weekend.